Hi there, I'm Ellie, physiotherapist here at o-health, and I'm joined today by Jas Saunders, our exercise physiologist. So Jas is here to talk to us today about our new falls prevention class. So Jas, I wondered if you just wanted to tell us a little bit about yourself to begin with.
Yeah, sure. So I grew up in Tallangatta. I did my high school out there, and I then moved to Bendigo to study. Once I finished my bachelor and my master's degree, I moved out to Horsham and did my third season as a firefighter out there. Went and travelled for a fair few months and then moved up to Queensland and was working as an exercise physiologist in Queensland, which I loved, but now back on the border and really excited to be at o-health and expanding the services for Albury-Wodonga.
Yeah, great. So you're going to be starting a new class here for people who may be at risk of falling in the hope to prevent falls, is that right?
Yeah, correct. So actually one in three individuals over the age of 65 has a fall each year, which is a really high number, and falls can result in disability, loss of confidence, reduced quality of life. So it's really important that we work to reduce those numbers as soon as we can. And among that older adult population, falls are the leading cause of injury-related death, which is huge. So it's a really important area that we look into.
That is huge. 1 in 3 is massive, and we know that for the large chunk of those falls, we can prevent them. So if somebody was at risk of falling, I know from being a physio, they're unlikely to want to come into an exercise class because they're scared of falling in a class.
Yeah.
So if they come to your class, what would they expect or what would they work on?
Yeah, so everyone is at a different point, and we understand that and expect that. So the classes are always supervised either by an exercise physiologist or a physiotherapist, and that is to keep the environment safe. So we're watching everyone, we keep the numbers quite small, and that way we can ensure that everyone's individual needs are being met.
Yeah. Great. So people watching this maybe aren't at risk of falling. They're maybe in that younger population group, the sort of below 60. So they're maybe thinking this isn't for them. But who would you want to see in there? Is there, talking about older relatives, friends, maybe people that are just at risk? Is there anyone in particular you want to see here? Is it just a bit of everyone?
So, anyone's obviously welcome, but people that are at a higher risk of falls, they may not even really know. So things such as reduced concentration, coordination, a history of falls in the family, other medical conditions such as Parkinson's disease. If someone's had a stroke, they're also at a higher risk of falls. So there's a lot of factors that come into it, and that's why we've got a team here, and anyone's welcome to come in and talk to us and see what would be suitable for them.
Yeah, great. And it's always, I know, quite an intimidating thing coming into a group environment, but it sounds like it's a safe place for people to come, and it's actually enjoyable from what I've seen of your classes so far.
Yeah.
And a bit social as well, which is always nice.
That's right. They're meant to be fun.
Yeah.
Exercise is meant to be fun. It's about learning a little bit along the way. It's about strengthening the muscles that you need for balance. Yes, they do work hard, but we also have a bit of fun too.
That's great.
So it's social, and it's meant to be a nice environment. Great.
That sounds great. Thank you, Jas.
That's okay.
And thank you guys for watching. So I think what we need to do is just keep an eye out from those around us, and if we're worried about anyone having a fall, just send them our way, even if it's for a chat, and if the class is the right environment for them, we can bring them in and give it a try and see if we can just stop people from falling, because we know that they are preventable. Most of them will have the occasional accident, the occasional trip, but those other falls, we can prevent them. So thanks for watching, everyone.